Hello, my name is Dr. Anna Maria Mihalta. I'm an internal medicine physician and an integrative health practitioner. Today, I am interviewing Philippe Reitz. He's in Brazil and he has a very interesting background. He, as a biologist, as an inventor, as many different academic positions that he's held. And he has done some remarkable research in vaccinated people and comparing those with unvaccinated in blood samples as well as thermal imaging studies. Hello, Felipe. How are you doing?
Hello, Dr. I'm doing well, thank you.
Tell me a little bit more about your background so that people can understand, how did you get to do this?
Well, first I studied biology and I specialized in medical diagnostics. And I moved to Europe and I developed a medical center there called the Integrated Medical Center, which became one of the largest integrated medical centers in Europe. So I got involved in working with the European Space Agencies and agency. I did some work with researching for new products to bring to the country, and it became a reference after a while in the country. So that's the way I found the dark field microscopy. That's where I found all the diagnostics that I used. And since then, my passion became on the dark field microscopy, because that's really what you can see the persons from inside out, so you can really see the person, um, how is she inside. So that's why I like so much.
Wonderful, wonderful. So what I would like to do is I would like to share my screen and then show some of your images and we discuss how and what you have found. Can you see my screen?
I can, yes, I can.
Wonderful, wonderful. So let's go to the first slide. So explain what do we see here?
Excellent. On the picture that you can see exactly, the ones that your mouse is on top, all the red blood cells is in the peripheral sample of the blood, and you can see the red blood cells quite rounded and quite perfect looking. Different shapes sometimes, but different sizes, but perfect looking. On the other side, you can see the difference where you can't even recognize a red blood cell. You can see that the serum, the black on the background, is has some lines and called some fibers in the background. You can see that red blood cells are all clumped together. So on the first picture is a normal blood cell, and the other picture I took from a patient that has been vaccinated by this experiment, injected with this experiment, and immediately the blood starts clumping in the rollo. It loses the integrity of electrostatic integrity. It damages your potential of absorbing protein, and it really messes with your blood a lot. So that's what you see, and those fibers in the background as well.
And can you tell me, how did you obtain this blood sample? Is it a finger prick or is it in the arm vein?
Peripheral fingerprint prick.
Okay, and then do you know, so how long after the injection is this, and how many injections had this individual?
Usually, I have seen changes in the blood after the first week or two already since the injection, and it depends a lot. There are three options, okay, for this injection. When they do the first injection, if the injection goes straight to the bloodstream, then the changes occur much earlier. If the injection goes to the muscles, and then the change can occur a bit later, because then all the chemicals, the graphene, the nanotechnologies, everything that we can see in the blood gradually can permeate to the bloodstream. But if you do it straight in the bloodstream, then 1 week is enough to see the changes. That's why some people have some side effects straight away.
Okay, should we go to the next slide?
Okay.
So tell us what we see here. So we have multiple different pictures here. What do we see here?
We start from the top there. You can that image is for you to compare what's a white blood cell compared to another white blood cell, but the same kind. One is the neutrophil white blood cell, and the other one's also a neutrophil white blood cell. In fact, what you see there are two neutrophil white blood cell. You can see the difference in size, and that's exactly what I want to highlight. A person that is not vaccinated, the white one is really good one. Is the right size of neutrophil. Everybody should have this size of neutrophil. Is compared to the red blood cell. Can compare there. You see, it's around 3 or 4 times bigger than the red blood cell. And then you look at the other side, you can see that the neutrophil is very small. And when the neutrophil is very small, unfortunately, this neutrophil is already coming from your bone marrow, that size. You already been produced that size. So that's why the vaccinated people is starting to have some immune deficiencies, you know, because the neutrophil and especially is starting to have, it's called the subpopulation neutrophil, when the neutrophil gets being produced quite small.
Wow, and then what do we see here?
Beside here, we see the number of platelets. You see those dust green in the background, all the platelets. They're not supposed to be that size. They're supposed to be smaller. So if the platelets are very large, so you can imagine what's going on already with the person's blood. And you can see some of the cells in the background, some of the red blood cells in the background as well. At the same time, you can see the shape of the red blood cells are not very round and perfect, clean shape. So that's image was to show exactly the platelets, because when you increase the number of platelets in the blood, you decrease the number of iron in the circulation. Okay, so that's what we see a lot. People complain of oxygenation deprivation, headaches, can't think properly. All this related to iron and hemoglobin, right? And the other photo down, you can see exactly what I'm talking about. It's called the hemolysis. Is the breakdown of the hemoglobin to the serum. So at the moment, how can the hemolysis occur naturally? Well, can only occur if you really have a much acidic serum, and you have, for example, you could also have microorganisms or something else that the blood is trying to attack and not be able to overcome. So the hemolysis is usually one that is more acidic. And
so
the other
you're saying if we're looking here, so what are these fibers here that we're seeing?
This image is incredible because this person took 3 of the vaccines. I haven't seen the first, the second, but I only saw the person after the third. So you can well imagine, you can see down in the picture, the red blood cells. You can even hardly recognize the red blood cells. And
Yes.
what you see in top of that, in the serum, all the fibers that you accumulating in the serum, all those fibers, they get together as a big clump, okay, big clump. And then when you do a test to see the coagulation is much heavier, you can see the results are much higher. So
so let me ask you, so in my office, you know, I've tested a lot of people with D-dimer testing, and the D-dimer looks at fibrin degradation products and is an indicator of microclotting. I've done a lot of studies in unvaccinated people and evaluated them for shedding phenomenon. So you're saying that in the vaccinated, you've seen a lot of these microclotting fibers. Have you seen them ever if somebody has been complaining about symptoms of shedding?
No, I haven't. And what I noticed that after the vaccine, around 2 to 3 weeks after the vaccine, is still shedding quite a lot. That's what I have noticed, because I had a couple that came, and one had been vaccinated, the other didn't, but just recently, and I checked both bloods and they're very similar. But then I decided to check them separately after 2 months, and the blood of the non-vaccinated has turned to almost normal, but the vaccinated continue getting worse. And exactly the D-dimer, if I did several tests with the D-dimer, every time I see this amount of fibers in the blood, the D-dimer is alarming results. Yeah, is one confirming the other.
So that's a very interesting finding in regards to that the unvaccinated appears to be able to clear whatever is making the blood clot, even though they continue to be exposed to another vaccinated person. So I certainly in my clinic have seen that the shedding appears to continue and that there isn't necessarily a time improvement. Did you treat the unvaccinated person with something that could have protected them?
No, I just advise not to get too close. I believe they have separated a little bit in the things at home, not getting too close to each other. But I also noticed that after 3 weeks, the quality of the shedding decreased dramatically as well. So I think that has an impact. And also, as an isolated case, I cannot show like thousands of research. I just a few people that I
Yes.
believe in.
Absolutely. I think, we are just endeavoring to find answers, to these questions. And I think that part of why we want to share this is to give other researchers and physicians some ideas about what could be going on. So I totally understand, we don't have randomized controlled trials. We are just sharing observations here to further the discussion and to be able to show this. But I think it's very important that all of us who are looking at this phenomena, that we share information and help each other find out what is going on.
Exactly. I think it's very important to for people to become aware because they have no symptoms, they don't feel anything. And when you look at the blood, when you look at the other diagnostics, that's when they become more aware and they become more responsible for their own health. The first time, they actually took the responsibility to go and take the vaccine, so now they need to take the responsibility also to look after themselves.
Yes. What are you showing in this picture here? Again, normal blood?
You can see several things in that picture, but mainly is the hemolysis going on. The red blood cell, exactly. See the ones in the background, they're called the ghost cells. You see the red blood cell, exactly. Those ones, they lose the hemoglobin and they have no function after that. So all the trillions of molecules of oxygen that they can carry when they go to the alveolus of your lungs, you will not happen anymore. They cannot exchange oxygen and carbon dioxide. So the person with not exchange carbon dioxide with the environment will become more acidic. The person not absorbing more oxygen is going to have problems with breathing, a short breath, and headaches, and I can't think properly, and all these symptoms. And then goes back to the physician, and the physician say, maybe COVID. Then you do another PCR test, which shows 97.9% of false positives, and the person ends up with the fear, which becomes more acidic, and the whole process goes again. We can see all these changes in the blood and the person. That's why it's so important to show this so that they can understand and to take the right direction.
So is this a vaccinated or unvaccinated person?
That one is just an example of a non-vaccinated person for you to see. But
and this is very important. I want to say something about this because I have many unvaccinated patients who, for example, had COVID and then developed long COVID, and they develop exactly these symptoms of air hunger, brain fog, etc. And I've been able to reverse all of those symptoms with high-dose vitamin C, with glutathione infusions, methylene blue, which is an electron donor, other supplements. And so it's very interesting that even in the unvaccinated would be interested. Do you know if this person ever had COVID?
No, that one, no. The picture in the top, the greener picture in the top with the platelets and the other side, Yes, those ones also have some ghost cells in the background. We call the hemolysis. That's the vaccinated person. And when you treated the person with anything that, like, the blood is acidic. So imagine that if you treat it for anything that can decrease the infection or that the person could have, and also the acidity in the blood and increase the iron, vitamin B12, hemoglobin, all this will make the person feel better. But if the person had, depends on type of vaccine, it could continue. The problem is genetically could continue replicating. So then the only thing you can do is maintenance work.
Okay, let's go to the next slide. And just for our listeners, I don't call these shots vaccines. They're not. They're, mRNA gene experimentation. I do not consider them a vaccine. But show us a little bit more about what do we see here?
Okay. I also call that injections. I can't call that vaccines.
Yes.
So all those injections, you can see in this picture here on your side. Maybe go to the other side on the picture. Oh, that you can see the red blood cells. You can see the size of that. Not that one, the other one. Yes, that's for comparison. That's the size of the red blood cell, which is around 7 microns or 7,000 nanometers, right? So what you see is a fermentation going on in the blood, just right there beside the platelet. Okay, so it's really fermentation, and those things, they start growing and they detach and they become like little rods, like you can see exactly like in the middle, and then you can see down also on the screen 1, 2, 3, 4, 5 rods there. Now that's a red blood cell in top. Yes, that one. So they move around the blood and they divide constantly and they keep growing. So as the byproduct of them is very acidic, it's a toxic and acidic. I notice people with this rod, these 5 rods that you can see in the bottom of the screen. I have noticed people having joint problems a lot when they have that. Okay, and vaccinated people that starting having neck problems, joint problems, wrist and lower back problems. I noticed that they have practically all of them would have those rods because they are producing acidity, and they located in the synovial fluid of the joints and dehydrated the synovial fluid of the joints. So the pain is usually worse by the end of the day.
So the other way of looking at it is, clearly there's an immune compromised state going on. We see, decreased size neutrophils. We can presume that they're dysfunctional and that these fungal elements that are creeping up in the blood, there is a balance between a healthy immune system and infections that are in the blood, and then if immune function goes down, these infections go up. And it's very interesting because there's, for example, some doctors, some oncologists like Simoncelli, Dr. Simoncelli in Italy, who discusses that cancers are also caused due to candida, and we've seen explosive cancers in vaccinated patients. So it's very interesting to see the effects of immune dysfunction here. So very interesting images.
Candida, you're quite right. All of them had some candida. For men, you can have a bloatedness, called the gut permeability has increased, and also itching, and for the some genital itching, as we see quite a lot. And this is exactly every person that is taking 2 or more of those injections developing some type of immune system compromised, and then fungus and bacteria can take their chance. As you can see in the picture in the top, the white one, that's a white blood cell neutrophil, okay? And they are supposed to be dealing with this, not being attacked by them, you see? So the immune system is really compromised as being attacked by the fungus in the blood. Too many.
Very interesting. Let's go to the next slide. What do we see here?
Wow, this is one of my favorite discoveries, I say. As you can see on the side of those lines, maybe the other, yes, start from there. I have never seen that. I probably have like I have thousands of images, thousands of patients that I have seen so far. I never saw that before. It looks like an aggregation of some type of material like I haven't seen, and the size you can compare, the size is just the size of a red blood cell, a bit bigger, and they change. In fact, they change a little bit. If you leave in a slide for a while the oxidation start to occur, they start moving a little bit. And I try to do some experiments with electromagnetic changes on the slide, and you can see some kind of aggregation. So I can't say exactly because not my, I never saw, I could never study. So that's pretty much one of the most scary things I have seen in the blood so far.
And
The one that,
what is really interesting, if I may just interject, I have put out some of the findings of researchers around the world who have looked at the vials. For example, my colleague Shimon Yanovitz from Israel has incubated the vials of Pfizer, Moderna, J&J, AstraZeneca for 3 weeks at body temperature and found self-assembling nanostructures. There was a recent report from Germany that also showed that in the vials, there were many different metals that have been found. Dr. Daniel Nagasse from Canada also showed some self-assembling nanostructures. We have other groups like La Quinta Columna who found graphene oxide. But the chemical composition appears very complex. So there's multiple metals found. And most recently, Mike Adams did a biochemical an analysis of the blood clots found from deceased vaccinated individuals with these ginormous blood clots, and found conducting materials like tin, like sodium, aluminum. So aluminum. I think that clearly there's something going on that has to do also with these self-assembling nanostructures. We're assuming it's graphene hydroxide, but you also have found this.
yes, I believe that we are talking about the same thing, but I cannot confirm 100%. I didn't study that in details. The picture below that, if you go to the below that just first, leave the best for last. That picture there is very interesting because another thing that's happening a lot with people that are vaccinated, necrotic tissues start being appearing in the blood. Okay, in necrotic tissues, actually the tissues from the epithelium, for example, that is being destroyed by the graphene hydroxide, and these necrotic tissues accumulate a lot in the blood. And you can
So let me
see,
just explain for somebody who doesn't know the medical terminology. Necrotic means dying tissues, and epithelium are like tissues, for example, from the skin, and they accumulate and can create. This isn't supposed to be in your blood, correct?
it can happen, but happens a lot with people with cancer. So when the cancer starts really a more aggressive way, you can see that I have noticed a lot of people with breast cancer in the past when I did lots of work in breast cancer. I have noticed a lot of this type of images. Okay, you can see the blood is also not very separated from each other. The one in the middle I found it interesting because naturally you can find lactic acid in the blood. Naturally, you can find from people that exercise or find people that don't breathe correctly. But there is a structure in the top of that image that's quite square. It's quite
Yes.
sharp, right? So it's not a lactic acid. I know, I haven't noticed that. So I don't know, I couldn't get any closer than that. My microscope doesn't go less than 1 micron observation. So, but it's something strange, okay? So I decided to show you that as well.
Fantastic. It certainly looks similar like the nanostructures that were found in the injection vials. What
Yeah,
is this? What are we looking at here?
okay, this is one of my favorite images because you can see the red blood cells up there. You can see the rounded red blood cells, and you can see exactly that square that is there, maybe that square. Those little dots, kind of gray dots, in comparison to the red blood cell. Uh, as you know, graphene hydroxide is around 40 nanometers, okay? And a red blood cell is around 7,000 nanometers. So the graphene hydroxide is around 140 times smaller than the red blood cell, okay? So if you want to look for graphene hydroxide, which is very sharp indeed, it is 140 times smaller. So then I made another image below, treating the image just to get a bit closer. And you can see better that every single gray dot that you see there is graphene hydroxide. You know how I know that? Because if you expose that to some electromagnetic frequency, they tend to move, okay? A little bit. They tend to move. Like sometimes I don't know. Some people's mobile sometimes can do that for the graphene to move for some type of frequency they send. Absolutely, 5G will be the depends the frequency of the 5G. 5G from China will certainly will cause you a lot of problem on that. So that is interesting because I have never seen that before. And the past 2.5 years, I started noticing a little bit here, a bit there. But also noticed that people that didn't have the vaccine or the injection for this experiment also appears to have some of this graphene hydroxide. And then when they start researching where this came from, there are a few options. Mostly people that use those masks, they use a lot of that masks that came from China, those that you buy in the pharmacies. The ones that use the ones made by hand, made at clothes and at home, it didn't have that, okay? So the ones that, the places that you have a lot of chemtrails also appears to have
Absolutely.
that. Water, the big cities with water supply and some of the food, for example, chocolates, we know for sure now that big companies like Nestle and all these big companies selling chocolates, they have a lot in chocolates, in coffee now as well.
And
And
meat, in the meat section, you should take a magnet to the meat section.
that's true. So that's what I think is incredible to see those images because this graphene hydroxide is so sharp that we're going to see in the next slides what the consequences of that in the body.
And
Okay?
what I think is very interesting is, again, you know, in my practice, having checked so many unvaccinated patients who were in contact with vaccinated, had elevated D dimers, and then we did infusions with vitamin C, glutathione, the peptide epithalon helped a lot, and put them on an oral supplement regimen, also with ivermectin a couple times a week, hydroxychloroquine 3 times a week, things like vitamin D, zinc, quercetin, hesperidin, diosmin, and we would reverse it regardless of how high the D dimer was. And so the question has always been, what exactly is shedding? And now more and more, even my colleague Shimon Yanovitz found nanostructures in his own blood, who's unvaccinated. Dr. Philippe Weldenberger, I believe is his name, from Italy, has shown that what appears to be shedding could be graphene oxide. So this is very interesting finding. So what do we see here?
Well, this is the first comparison I want to show you what is inside the body, what you can see from outside the body. So you can see a compromised immune system. Again, it's another cell called the eosinophil cell, a white blood cell, being attacked by a fungal infection. So a fungal infection. So you can see that. Add that to that infection to fibrins. Usually, when you have fibrins, you also have infections. As you can see there in the middle, that the four rods, you're going to have some expressions in the body in blood clots, peripheral vascular diseases, and circulatory problems. If you look it down, also protein linkage, as I showed at the bottom of the screen, protein linkage, excess protein in the blood, plus Rollo, which is also excessive protein in the blood, but everyone that's vaccinated, every single one that's vaccinated, would you have some image like that Rollo, or even worse than Rollo. But before that, people that are shedding and people that are not vaccinated but received this effect of shedding, they would have a lot of the 1-bacillus protein linkage, which is a precursor of this Rollo. When you have protein linkage, means you're not capable to assimilate, to digest this protein correctly. And that's a lot to do with the exchange on the electrostatics of the cells as well. So infections, foreign substances in the blood, all these start changing. And then, but Rollo is the end result of those that took the vaccine. So what you see on the side of that is the consequences in the peripheral vascular processes.
So let me just say, so for me as a doctor, first of all, when you sent me these thermogram images, I was shocked, absolutely shocked. And I want to explain to our viewers. So first of all, you know, the red blood cells, they are able to bend very well in the little tiny capillaries and the little tiny arteries. And imagine that if they lose that ability, how much clotting, microclotting occurs, and then in fact macroclotting, meaning big clots. And so what we see here, this is an infrared thermography image, which has been shown in scientific studies to be a way to also diagnose deep vein thrombosis, meaning deep blood clots. And it looks also at the vascular perfusion of, for example, superficial veins. And I just want to say here, so this is the leg, the calf, and this entire structure here is a blood clot. And then look at all of these veins here, all of these superficial veins, and it appears they're all clotted. Can you tell us a little bit, did this person feel anything, have any symptoms? This is incredible.
Yes, I have no symptoms, asymptomatic, discovered here during the evaluation. And I actually was surprised to see, because it was a young person, first of all. And
how young? How young?
23 years old, athlete.
That's shocking. A 23-year-old athlete has this extensive clotting. That's unbelievable.
I do believe that most of those athletes that are dying from after these shots and these injections, as you can remember the graphene, you can remember these red blood cells in form of Rollo. Eventually, they wouldn't be able to go through these microcapillaries, and then it creates a backlog, and then that's it. Suddenly you die. You have the blood stops moving to your brain, and that's it. And other thing happens. Some of the athletes would have images like that, as you see in the thermal camera, the thermal image, and they are completely unaware, and they're going to continue doing exercise. They're going to play football or play rugby, or when they have a contact with that area, an impact on that area, you can imagine that the clot could just release, and that's it. It goes straight to cause a thrombosis, and the person is completely unaware of that.
So did you send them for an ultrasound, or what happened with this person?
Was sent to do a Doppler ultrasound, which confirmed a blockage and the clots, but also in some other cases confirmed a valve dysfunction in the circulatory system. So the valve, instead to open like this and close, open and close, it goes, one opens, the other one doesn't, you know, and because it's completely blocked. It's like the blood is like a glue, and the valve got stuck and then just moves a little bit. So the whole blood starts accumulating down. The return the return of the blood start accumulating down, the legs start getting a bit swollen, but no symptoms, no pain. Until it's too late. The pain comes much later when the thrombus is able to move a bit.
Shocking. This is more images. And again, I'm just shocked. Look at this blood clotting here everywhere. This is incredible. And what I think, as a physician, we need to screen and potentially use this thermography imaging for everyone who's gotten the clots, because no wonder people are having sudden adult death syndrome. The doctors are saying they don't know what it's from, but if they were to do this thermography, my God, what would they find? This.
Yes, exactly. And as you can see, people are dying now driving, or especially going to the beaches. In Italy, you have cases now recently, more than 10 people dying on the beach, doing nothing really, just lying down there, because the sun, the radiation of the sun and the heat makes the blood to flow a bit faster. And they actually probably have some images like that, but they are not aware of that type of image. So they took a risk going to the beach without knowing. And what I want to show with this slide is the relationship between the small neutrophil called subpopulation neutrophil with all these images that you're seeing. How can a neutrophil be associated with blood clots? Exactly, everything is connected. That's why it's so important to look at the blood analysis and also the condition. The blood analysis is going to give you a view from inside to show, yes, you have the fibrins, yes, you have the subpopulation neutrophil. This means you're much more in the direction of cancer, okay? And then you can look at the thermography, you can say you're much more in the direction of circulatory problems, even heart problems. So that's why I look at those two types of diagnostics, because the people that are being injected, the majority are going to go for either two ways, or cancer or circulatory problems. And here we see both at the same time.
And the dangerous thing is really that they're not aware. The fact that this amount of blood clotting can be asymptomatic. Usually, in medical practice, you would suspect a blood clot if there's swelling or redness, or, one leg swells, the other doesn't. But what you're saying is that the majority of these people had nothing to indicate that there's a problem. And so that is the danger of it. It's people think they're fine, and that also answers this whole question, because so many vaccinated people says, oh, the shot is not a problem because I don't have any symptoms. But oh my God.
Well, the shot is not a problem. I don't have any symptoms because the shot was given a muscle. If the shot was given in your blood vessel straight away, which some did, of course, you have that as a Russian roulette. Either goes to your blood or goes to your muscle, who knows? If it goes to your blood, it directs your blood, then you're going to have
But I mean, they've shown in studies that even if supposedly it was supposed to stay in the muscle, but really that the mRNA accumulated like in ovaries, and it would reverse transcribe into your DNA within 6 hours. I mean, who knows? Whether or not this is really dependent on being injected into the muscles or not. I think that the biggest point is that asymptomatic people who have received the shot may be walking around with massive blood clotting, and this could lead to a near fatal or fatal event at any moment, and it needs to be evaluated. I think that it's fair to say that.
Absolutely. I call it a ticking bomb.
A ticking time bomb, absolutely. Can you explain a little bit? This image was very disturbing. So these are microvessels in the abdominal wall.
Yeah, the whole body, generalized. I just put the abdominal because we already saw the legs and you can imagine, but it's abdominal, the back, the legs, the arms, the face. You cannot see, if you look at the person, it's normal. You wouldn't notice any difference whatsoever. Even the person doesn't know. And but that, imagine trillions of small razor blades going around your body constantly, called the graphene hydroxide, and making little cuts. One cut here, one cut there. What happens? Your body gets inflamed, and that all the cuts will necessary to have platelets. Will necessary to have the white blood cells to deal with. You don't have enough. You don't have enough white blood cells because they become smaller now and they cannot deal with the problem. And then what happens to all these damaged epithelial cells, tissues, as I said, they accumulate in your blood, as you can see the picture on the very bottom called the protoplast. They are pieces of everything. They are pieces of platelets. They are pieces of red blood membranes of red blood cells, then tissues, and everything that accumulates there. And then the body is going to try to eliminate through what? Usually through the urine. You try to eliminate it through the digestive system, but urine. So it goes to the kidneys, and then the glomerule in the kidneys with the filter that filters all the substances from your body gets blocked. When it gets blocked and you have all these bacteria and fungus accumulating there, it cannot eliminate it fast enough. So they grow in that area, they become a urinary tract infection. Then the person now has a urinary tract infection, and you can incapable to detoxify their own body because the amount of toxicity is more than actually he can deal with. So that is all this domino effect.
Yeah. So, I'm not so certain about the overall correlation to urinary tract infection, and some of what you're sort of maybe explaining as a physician, since we haven't correlated that necessarily to clinical practice. This is what you're thinking about this. I think that these images are stunning, and to find ways of causality, it's clearly not normal. The message needs to be, the injections need to be stopped immediately. We need to find ways to detoxify people of graphene oxide, with chelation, glutathione, N-acetylcysteine, other things. But clearly, this is profound toxicity showing up, and very, very concerning. So this is your blood, it's your life, and it's your choice. Thank you so much. But I wanted to show a couple more images that are also from you and really show them as a big image. But first, you are also an inventor. And what is this scan that you invented?
Well, this one I started in Europe, and this is the first device that identifies, evaluates, and quantifies pain simultaneously. It has been a type of project I'm doing for a while, and I started by saving insurance companies a couple of billions of dollars and euros per year on the fraud. That was they started because the people say I have pain, but you cannot prove that. So now we can prove through the pain. So I have published few scientific articles, neuroscience methods, and the British Journal of Physics, and so on, using a methodology that you can say if the person is lying about pain or not. So that
Excellent.
really,
Looks very futuristic.
that's much. It does a lot more than that. The idea is that that machine is become one of the first stop shop, as you call. A person goes there, you do everything. You can do ultrasound, you can do everything there. Your avatar, 3D imaging, everything in the same machine. And it's the first patent in the world with that at the moment.
Wonderful. Congratulations. I wanted to just show these images at a larger scale, just because, again, for me as a physician, When I saw this, this was most impressive. I want to share this with other colleagues. This is how extensive in the entire venous system this blood clotting is. And you can see here, this is a different image. It makes it more contrast. What is the difference between the previous image and this?
Just a different contrast. One is in black background, another one is in white background.
And this also, are you thinking that all of this is also from the graphene?
That is related to the circulatory. When the person has some type of accumulation of this platelets, or as you call the accumulation of the leg gets almost like a preparing for the thrombosis, let's say. When the process is so blocked, that creates pressure upwards, okay? And then the consequence is that all the veins that you have never seen start dilating as well. So if you see the veins dilating in your abdomen like that, it's because the lower limbs have been really compromised.
This is phenomenal. This is the same thing. It's just incredible. So
This particular had four injections.
four injections. Oh
This
my
one,
God.
and again, didn't know about it. Doesn't feel much, but when you saw that, then become aware. I say, wow, yes. Now I understand why it's a bit itching here, a bit itching there, because this minor cuts cause a bit of itching in the skin, and also and sometimes depending the extension, you can get a little bit reddish in the skin.
Wow.
Then you can see the lines on the side, as I mentioned before, the veins started to dilate here, and one of the right side and the left side at the same time. And this is one of the situations a bit more serious, I believe, from what I have noticed.
So this person has no symptoms.
None, none. It came for other purpose, not for this purpose. It came for something else, and then I said, let's just, it came for the blood analysis, and I said, let's do this evaluation as well. I must do. I'm not charging. I just wanted to put together. And then I evaluate and I said, see all these marks that you have here? It's not an allergic reaction, as you can imagine, because allergic reaction can be like that. They are all cuts. This person had 3 injections of Pfizer.
Oh my God. And so here again, deep, you see there's these blood vessels of thrombosis. These are ginormous clots. And this would go along with what the embalmers are finding of clots that are as long as the leg, where, in 20 some odd years of my career, I've not seen something like this.
Yes, exactly. The post-mortem observes those clots that you can pull from the veins quite long, and this person is alive and is doing all the tests. And I do believe that I do believe they're going to try to do any kind of treatment. Unfortunately, they are not linking with the shots, with the injections. Although I keep saying that the person also didn't know about it, that was always very healthy. Now that's aware of that, is afraid to exercise, afraid to move.
So you are helping these poor people, and the doctors in your community are not recognizing that this is related to the shots. This is just unbelievable.
They cannot recognize, otherwise they lose the job, as you know.
Oh my God. Lose your job, people. This is unbelievable.
Yes, yes. It's unbelievable. It is sad to see people like that. It's really sad because some of them we have been telling them for the past 2 years, giving information, we giving articles, spend days and nights answering emails, and still people say, "Well, I saw in the television, so I'm going to take it." Or the same thing I have noticed, people say, well, sorry, but I had to take because I had to go to work. And they say, okay, now you're going to need to spend all the money that you earn and work to pay for medical treatment. But unfortunately, if you go back to the same doctor that actually gave you the problem, you're going to be treated by the same person that gave you the same poison. So I think it's a very tricky situation now for those people that are discovering the truth.
Wow, I just want to say, bless you, because it has been so challenging to really get a broader picture. And when you contacted me through my Substack and then you sent me these images, I was beyond shocked. And thank you for allowing to share this with the world. Bringing forward to potentially a new diagnostic mode that other physicians and healthcare practitioners who first of all, they need to get out of denial and say, it's like, look, since the injections were rolled out, this is, when the sudden adult death syndrome started and the myocarditis and people dropping dead, and it's like, stop denying this and start looking at this and remember your oath as a doctor and take care of these people, and above all, stop the shots. Doesn't matter if you lose your job. You cannot do this to people, and you will be held accountable and prosecuted. And if you know about this and you continue to give the shots, you deserve to be prosecuted. So thank you so much. Where can people find more about you or contact you with your work?
I have my contact in all the slides that you showed in the email. And yes, we can you can share some more information. I start seeing now children with the same problems, and then maybe I should collect some images to show you later. And now even 3 years old with some plots similar to what you have seen, and 5 years old that not aware of that. 5 years old with almost no immune system already. Because continue wearing masks and continue taking these injections, I think the parents are committing totally a genocide in their own family.
Thank you so much, Felipe. Thank you for all of your work. This was incredible, and you're a light to the world. And thank you for all the care that you give to these people who have nowhere else to go. Thank you so much.
Thank you for sharing.